Fillers are substances that we inject into our skin to plump it up, to restore lost volume, as well as to fill wrinkles and lines. There are many different types of fillers on the market. The most common preparations are those using natural hyaluronic acid. There are other fillers that are semi-permanent or permanent that employ other ingredients such as silicone. People often confuse Botox with fillers. Well, Botox are used for dynamic lines. This means lines that appear when you create an expression such as your frown lines and your crow's feet. Fillers are substances such as hyaluronic acid used to plump up your skin, and they are best for resting lines, such as your nasolabial folds. These lines are there even when you're not smiling, and so when you use fillers, you are able to plump up the skin and reduce the appearance of these lines. With Botox, you get your effects after 7 days, whereas with fillers, you can see the plumping effect immediately after the treatment. Since there are so many different fillers on the market, if you want a safe and effective treatment, my advice is to go for fillers that are made using natural hyaluronic acid. This is because these natural substances will slowly break down over time, usually about 6 to 12 months. But there are also many different hyaluronic acid fillers on the market. FDA-approved brands include Bolotaro, Juvederm, Restylane. If you are looking for safe and effective fillers, you may want to look out for these brands. Other things to watch out for is to get your fillers done at a licensed medical clinic and with a doctor that's skilled in administering the fillers. You need to know that as with all these injections, the skill of the doctor is paramount in giving you a flawless result. Fillers in untrained hands may lead to them being placed in a wrong position or in wrong dosages. This may lead to injuries to your blood vessels, infections, and a result that is unappealing. You also need to know there are a few ways you can administer the fillers. One is through sharp needle, and secondly, through a blunt cannula. When fillers are administered with a blunt cannula, they are associated with less bruising and they're usually safer. If you're worried about bruising or side effects, speak to your doctor about getting fillers using a cannula. Fillers cost anywhere between $900 to $1,400 before GST. If you've been offered fillers that are too cheap to be true, then always check that they are using the genuine products for you. Immediately after the treatment, you may see some pinprick marks, which will resolve in 1 to 2 days. Occasionally, you may get mild bruising, which lasts for 3 to 4 days. The resolution of this bruising can be accelerated by taking Arnica tablets. Some patients experience mild swelling after filler procedure. Again, there is nothing to be worried about, as these swelling will usually subside in a few days. If there are any other side effects that you experience that make you uncomfortable, you should immediately call your doctor to reschedule an appointment for a review. Fillers that are FDA approved are safe and effective in trained hands. Always speak to your doctor to see if you are a candidate for filler treatments. Be careful about unlicensed beauty injections, including vitamin drips and whitening injections. These use unapproved ingredients and may be given directly into the bloodstream. While they make claims that are too good to be true, the side effects are serious and may include death.